Now for this morning's Health Watch, where we talk about the big health headlines of the week. He is the most dedicated doctor around, Dr. Syed Hussain from Trinity Health, joining us from Saudi Arabia, where it's 66 degrees and sunny. Doctor, we appreciate your making the time. Happy Thanksgiving, my friend.
You as well, Keith. Thank you for having me.
All right, so I'm putting you right in the thick of this debate I'm having this morning. I feel like we have this conversation every year. We're talking about these Thanksgiving leftovers. The Fox 61 kitchen is stacked with turkey, stuffing, you name it. How long can we keep that stuff around without getting sick, doctor?
Yeah, great question, Keith. So most experts recommend not more than 3 to 4 days. Of course, food needs to be refrigerated, either refrigerated or frozen, but if it's refrigerated, not more than 3 to 4 days. So by Monday after Thanksgiving, Thursday, we should probably clear up whatever items you had in the fridge. There are a couple of caveats here, though. Some items are more perishable than others. Homemade bread, for instance, probably won't last as long. If things are frozen, then they usually last for 2 to 6 months. If you have someone who's immunocompromised, pregnant, or above the age of 65, then some additional precautions that need to be taken for listeria, for instance, which doesn't really, which can survive in lower temperatures in the fridge. So when you're reheating food, it needs to be at least 165 degrees, if not higher. So using a thermometer would be something that would be recommended for those individuals. So just a few pointers to keep in mind.
All right, certainly noted there. Some good tips. Listen, you and I talk a lot about alcohol on the show. The holiday means partying and drinking. For some, a lot of drinking. Some new research came out this week in the National Library of Medicine that says there's a type of drinking that's worse than binge drinking, doctor. It's called high-intensity drinking. I'm just hearing about this. Researchers describe it as twice the typical binge drinking threshold. Dr. Hussain, we're talking up to 10 drinks in a sitting. We know this is dangerous, but talk about why.
Yeah, this is very worrisome. It's a new trend, and we're seeing it associated most closely with holidays and folks who may be prone to binge drinking, Keith. Holidays, 21st, birthdays, any kind of event that may trigger someone to drink even more than what they would do in a binge drinking episode. So as you mentioned, 10 drinks or more for men is the threshold. It's usually double than what it is for binge drinking, and 8 drinks or higher in women. It can lead to higher blood alcohol concentration levels, 0.02% or higher, which then translates into effects on the body, which can lead to injuries, overdoses, and death. So this is quite worrisome. Patients may actually get admitted to the hospital, maybe suffering consequences from alcohol intoxication, as well as more prone to suffer long-term from alcohol use disorder.
Wow, incredibly dangerous there. Okay, one more for you. Some doctors are saying they are closer than ever, Dr. Hussain, to understanding the brain fog with some people with long COVID. A study by the Radiological Society of North America says it may have to do with the lungs. Talk about brain fog. What do we know?
Yeah, what's fascinating, Keith, is 4 years into us knowing about this virus, we still continue to learn new things. And this is a study that was done in a small group of individuals that had abnormal impaired lung function, which is, the functioning of lungs is really important in terms of gas exchange. Oxygen coming into the bloodstream and carbon dioxide leaving the body. And so if that's impaired from COVID, then there's the study looked at what cognitive impairment or cognitive effects that may have on the brain, for instance, and an MRI that was performed both for the lungs and the brain, as well as some cognitive tests. There may be some causation there. More studies need to be done. But like I said, it's still fascinating how much we continue to learn about this virus.
Dr. Hussain, I always learn something new when you join us. Safe travels back from Saudi Arabia. We'll see you back in studio next week, my friend.
Thank you, Keith.